of all, let us say who is doing what. We don't know exactly. I think if we can capture that in one of the module, I'm sure that is going to be one of the very important, interesting things. Another issue, I know that Mr. Sam Pitroda's Knowledge Commission. In the Knowledge Commission, obviously the initiatives have been taken that all the ministries will be linking their all web portals so that we can have the sharing of information. Of course, this process is going on, but that is only for the public sector. So where is the private sector inputs into that? And I think it's very much needed. That is one issue. Another issue, I was just, when Dr. Nagpal was talking, and we do have many other players and partners to take the challenges, what not only all of us have felt and Mr. Sam Pitroda has also identified. Most of the time, the management, key hardcore management issues are not really being handled. You know, many times we are working as a professional on technologies or medical, but their execution on medical, I think there's a high need at the moment that we start orienting the healthcare providers on the management techniques. And there's again a need that the private sector can come out with well-tested modules. Those well-tested modules can be really taken advantage by the public sector, and then they can go. Because many times the innovating and creating these newer initiatives are also sometimes not only cost-wise, but probably some kind of an attitude-wise also is needed, where public sector doesn't come forward very fast, because so many things are bogged down at the headquarters. So somebody has to concentratedly work, but once those modules are ready, I think the government sector or public sector as a partnership can really take them in a very cost-effective and beneficial manner. So I'm sure, you know, what we're raising, we have, like Dr. Lal, I was just discussing him, he's also the member of our high-level task force, which we have created, invited our experts and the organizations to guide the government at how best we can do. But I know that there are limitations, the regularity and promptness is definitely also an issue. It's again a management issue we need to address. So like this, I think if we can, through these kinds of fora, if we can also compile their valuable suggestions, and after compilation, those suggestions can be really pursued in the right level in the government. I think that is more important. I have been attending, having an opportunity of meeting such a wonderful group. But what happens is, probably the outcomes of these kinds of wonderful groups, probably they somewhere remain and don't get pushed. Because this, I know, is a difficult task. It's not a simple task because many things have to be pushed into, and the government has to function with its own frame. And there, a lot of democratization is there. So many things are fun. IFT is involved, the technocrats are involved, the bureaucrats are involved, somewhere non-groups are involved. So, all these things have to be handled. But then pursuance regular is an essential issue. And I'm sure it does fall. It does fall with the right.
My experience has been from the reform that I am very happy to say, that I don't criticize the government. I have seen things moving. What you said is very right. If you can put actionable items and very specific, that's why we got it, then the specifics of the meeting can be offered something concrete to the government. And yes, when it comes to follow-up, I can tell you the government will do follow-ups. They have formed committee where people like us are on the advisory groups, and we want to make sure that gets translated to a product based in the industry. That's why you have been for otherwise. I think a couple of us do spend time with the government in various discussions, but when it goes to people like you, I'm going to put specific inputs against your name and take it to the levels, and we will see and wait for the outcome. So Girish, Sudarshan, Navin, and Hemandi also. Start.
I think for the first time I have interacted with government officials, and honestly,
the name
I'm Hemandi, and I represent the pharmaceutical industry. I'm the president of Rapid's Brett. For the first time I interacted with government officials, and I'm pleasantly surprised that there is so much that has been done by the government towards healthcare. And I personally feel that at company level, at the industry level, we are all willing to contribute towards the healthcare. And like I saw in the rural insurance, I think something like this, companies like us can contribute in a big way. In the sense, if what sometimes it happens to the industry that we don't believe what the government says many times with due regards. But if we are actually taken through with such presentations, or if we are actually going into the field and working with these people and seeing what's happening, I think there is a lot which can happen to the industry. Like a simple example of Apollo and the interaction with Sri Anilji. And they immediately said that we will work together on a particular thing. I think that's what is the need of the hour, and that is what can come out of such interactions. And if these interactions are regular, I think there is a lot which can come through. And I can assure you that we are definitely willing to contribute towards the healthcare of this country as a company also, and I'm sure as an industry also.
I just wanted to add what you were mentioning about the role that this particular forum can play. I think there are enough forums that create, thinking and policy, and as somebody said earlier, prescription and diagnosis. I think perhaps one role that we could all play is really the marriage of government and private. Is in terms of, we all talk about PPPs and all this kind of a thing. If you would actually identify maybe 3 or 4 actual projects, which can be PPP projects, which the government's need is there, and we as an industry body have the wherewithal to be able to participate in, and say, okay, let's take on these 3 projects. And actually now let's talk to the government and talk to the companies and see how can we actually make these happen. Otherwise we talk about a lot of these PPP, and in every forum we talk about PPP, and there's a desire for it. But in its implementation and actual nitty-gritty of it, it doesn't really, it happens, but it happens not perhaps in a specific concrete manner as it should. For example, you take the thing about diabetes. Now, we as a company have a lot of stake also in diabetes. Diabetes management is a major area of business for us, and we want to participate with government programs, with the NCDC, the non-communicable disease program at state level, at center level. But as a company, what doors do I knock? How many doors do I knock? Who all do I go and meet? Is always a question mark. Okay, we want to do it, so we do it, but after a while it becomes, okay, let's now put our energy somewhere else because it's not heading anywhere. So I think a forum like this would actually bring all that together, because it does require more than one company, it does require more than one expertise to make it effective. So I think we would want to participate in something what you mentioned on diabetes. We don't know how. We can share with you what we can bring to the table. Every participant can share what they can bring to the table, and this forum can then put that together and work with the government.
I'm sure, I think that is the way out, that those of us who are sitting here, they know. And I'm sure every of the corporate, they do have keeping the social responsibility into view. I'm sure every one of you do have the resource mobilization for your own research developments, and also for some kind of the social service for that. And as a part of that social service, what you define for research and development, if the same principle is applied, that if you have to do for the social service, what kind of social service you can think of from your own end, and whatever funding and those things that they are crystallized very clearly. I'm sure you can write to those concerned nodal points in the ministry. If you look at the ministry, whether the national government, we have our own websites. The website very clearly defines who are the nodal people for that kind of work. And you can definitely communicate with that. And obviously, the Director General is open for every one of these. But we have to concretize. Number 2, let us also not forget that when we have a partnership, I think both the sides have their own way of working and sometimes the limitations as well as some kinds of frames. So I think we have to respect that also and work out a viability that how best. But there is no rigidity. I mean, I've seen in my own experience that sometimes I may be rigid because of my ignorance. But once in the moment you know this has to be done in that flexible way, so we are open for that flexibility. And I think it's a both way and mutual kind of thing. So communication is the key of the whole issue.
Girish has been waiting, so if Girish, Sudarshan, and then this Girish can speak, and then we can have others. I'm so sorry.
Yeah, thank you.
Maybe let's say I'm just the great advantage of this group is that we are members of the industry and government. And as an industry person, when we do something, we like to make a difference and we measure the outcome. One of the things which has been talked about is screening programs only for districts. But unless it is also managed and integrated with the treatment and compliance, the outcome will not be there. So one of the areas where as a company, Abbott is a leading company, that the knowledge is there and no knowledge is there. We can play a very important role to come with integrated solution to manage the outcome as far as that is there. Secondly, I was talking to Dr. Nagpal that JNK is a state where the mental problems are very heavy, and we like to cooperate with Dr. Nagpal to make a difference in the mental health area because we have a leading presence, and there can be a definite outcome, definite project to move forward in that particular area. And third, which is very, very important, is the use of technology to get the more access of medicine to the market and diagnostic area, and we have got the advantage of Nokia and RF and we there. So maybe one of the projects as an outcome of this meeting, because we spent half a day here, that is very important time. So maybe some of these areas will like to take forward with your help and great initiative, I will say, on your part, that you got all of us together. We will like to take it forward.
Yeah, my name is Girish. I work with Care Hospitals Group based in Hyderabad, and I specifically work with the rural health areas and treating more than 2 million population. Basically, coming to the just to summarize the other colleagues and members who are talking. The two things which we know is one thing which we know instantly we want, maybe sometime, which are the existing things like NCD or it could be any other proposals. But there are evolving issues or evolving challenges which needs to be discussed and put forward over a period of time. That needs to come up. What are the things which are required at for many years time? What are required as a solution itself? Because all experts or expertise across the tables can sit down. So the workshop should be enabled like, okay, these are the challenges, what could be done, could be a plan of action, ABC, and could be discussed through the panel and with the government and engage and see what would be evolving solutions to this and the existing how could be implemented. Other thing is, the major thing is the time. How we can crash time because so much of time is spent in discussions and to the dialogue to translate to action, how we can actually crash time. The interface could be web or in form and medium, but how we can really crash time and how we can bring the expert pool to the right table to discuss the whole solutions. And also is that how are the stakeholders, means from the private to the public, how is the stakeholders response from the other end, how fast it happens and how is the communication loop. I think these are 2-3 things which if is taken properly care and put around across to everyone, I think it makes sense to make a much strong bond across to make things into action and implement.
Girish and then Raju. Sorry, we are running short of time. Probably
Yeah,
go there.
I'm also Girish. I lead the healthcare and life science vertical for HP. Thanks for the opportunity and just to summarize on the way to go forward. I personally feel that I've been in the government for about a century. We've been getting PPP for a long time. I don't think in healthcare we achieved anything great big. And one of the main reasons, and I'm just subscribing to what the gentleman said, is that we haven't had a focused approach. We're just talking about PPC across the healthcare continuum. It doesn't happen. We need to have focus, like Rajendra said about, say, if it is disease management or is it screening, pick up an area and make it open to the private partners to come in and work in that area. Keep it reserved for, like if you have a parliamentary constituency, reserved for women candidate, something like that, we need to open up and say that PHCs in this district, this many PHCs are open for private public partnership. Similarly, I'm not only talking about the care area, I would definitely talk about the technology area, where you should open up and say that this is, because everybody can't do everything. You can have partnership in some focused area which will make it successful. Otherwise, we will achieve nothing, try to achieve everything. So my point is that, say, everybody got same point today, two important issues that came out from a technology standpoint when I look at it. One is data, credible data. We don't have. We know the kind of statistics that comes up to us. Nobody actually can vote for it, national statistics also. The second important issue that we talked about is the skill set, lack of skill set, training, things like that. That is where I'm not talking about, the moment we talk about technology in a hospital, we talk about a full-fledged earmark, paperless hospital. It doesn't happen. We need to start somewhere. I think we should start with registering every patient in a system. Do away with all government hospitals. If we can do away with paper registration and start only do that. Please do not do anything beyond it. Try to attempt everything else you will achieve. Anything. Just make sure that in 2 years window, 3 years window, 5 years window, all government hospital demographics of the patients are captured in an electronic system. You have a credible data of these patients. That's an area which we are working with Maharashtra government. If you go to any of the Maharashtra state governments, hospitals, especially teaching hospitals, 19 of them and 14 medical colleges, I had a discussion with the minister and the secretary, and I said that we're investing in IT. The patient waiting time was 1 hour and 10 minutes average. What have we achieved by investing this public money? I took it on a contract yesterday that I will bring down the waiting time to 20 minutes or so. I think in 2010 we got a national award for Best Citizen-Centric Program. We brought down the waiting time to about 10 to 12 minutes or so. Now the question is, if you talk about technology and the end user, the consumer doesn't get the benefit of it, the partnership doesn't work. Second area which I wanted to talk about is training. If you look at healthcare, healthcare is an area where technology used least in training. Like in any other profession you will find CBTs, computer-based training. Retraining is an area which we don't hear about. Be it ASHA workers, any of them, they need to be retrained. It's not training one time at all. There is no scope other than CMEs for doctors. You don't see much of retraining happening. That is where technology can help you. Like you can have online examinations. You can have CBDs set across to them. You can have simulated tests run for them. And like point of care testing, you can have point of care training because you can't collect all those people as if there is a deficient. People are not there. They can't come in training sessions also. You can't withdraw it. So these are two focus areas from a technology standpoint of view as low-hanging fruits that we can pluck. I would like to pluck. One is in creating credible patient data, at least from a registration standpoint, not from an EMR standpoint. Second is in participating in training and use of technology for training, especially in the rural workers.
Hi, can I just very quickly?
Just Melvin has been the first. We'll have you.
Sure.
Yeah, sure.
I'm Melvin D'Souza. I represent a company called Novo Nordisk. We are a leader in diabetes care. Of course, there are many more companies working in this space also. I can just narrate my experience of working with the government, and I think it has been actually a very wonderful experience because we've been working with the state governments. Today I can say that we have adopted around 7 districts in Bihar as well as in Gujarat. We have full experience of working in the state government of Goa, and yesterday we signed up with Pondicherry. The work what we do here is we are looking at trying to not only look at screening per se, because I don't think so screening is an end in its own. We need to just look at how do we actually try and measure what has actually happened, share that experience and find a way to improve that experience. What in our parlance, what we call as a diabetes barometer. When we present this to the state government, I can tell you our experience has been good because they are willing to sort of help us adopt these districts and actually try and see what those outcomes have been. I can also say, and when we look at the data that we get, I think so it is quite good. But what we look at when we look at the center is try and see what can we do when it comes to. Don't look at us only as screening partners. I think so going to a little bit of depth in trying to make sure that can I be a knowledge partner? Can I be that experience sharer in what you do? And probably I might have a different objective, and having a transparent way to discuss that objective and trying to make sure that whether both ends meet. I think so that is where we probably can add value. And I'm ready to discuss this issue, talk about many more districts, try and find out what is that we can do. Probably we might not be the finisher for all your issues, but what we can also do is probably be that one cornerstone, trying to make sure that it, of course, serves our requirement, but at the same time can also help you to achieve what we have set out to do. For example, if you're talking about screening, I can tell you in these districts currently we have screened close to 300,000 people. And if you have screened 300,000 people, we have that data. Of course, the data is in the government, and probably might not want to do those screenings in those districts. So probably that is a surrogate adoption of those districts from us, and actually will help you out in trying to reach out to other districts. So I think so it's a very symbiotic relationship, and I'm happy that I'm here today. I mean, actually talking to you, probably also getting an opportunity to showcase it, because our experience doesn't come out in making this happen in India, because our experience comes out from working with other full countries where we have shown that trying to look at diabetes per se, that if you work very closely, if you try and measure, if you try and share, if you try and then train those individuals who are interfacing with people, your possibility of getting down to blood sugar to an average much lower than what it is. I think so that is what we should aim for. It is a holistic approach, and like what Sudarshan said, I think so we don't look at only at just trying to measure something and get out of it, because that's not the end in its own. We try and make sure that can we now go to that next step to try and make sure that the person gets the right treatment, whatever it might be. It might be just diet, it might be exercise, it might be drugs, it might be anything, but at the end of the day, they get the right thing and bring the end point of making sure that we are in the country.
Any after your comment, what we'll do is we'll close, but individually we'll seek input from everyone and then put our report to the meeting, right? And I think 2 priority areas that it comes out, rather than 3, we narrow it to 2 so that we get action upon is diabetes and data, which is IT. Start with 2, with the screening, and then go forward to see how we can make an impact on the diabetes, the screening part, or probably go beyond disease management, I would say, and the IT healthcare IT. Let's pick up 2 priority areas and work with the stakeholders and see what change we can bring about in the near future. And
Yeah, so probably I would like to add one more point to that, but my primary point is that we are talking about, so I'm Annie Matthew from Research in Motion. We've been working in the telemedicine space for some time. So from the point of corporate social responsibility and giving back, we are working on it, and we have done successful pilots with Narayana Nechalya and Nanavati Hospital and all that. We've been hearing from Mr. Swarup about pilots that don't fly. So when we bring ideas to the table, I think we should pick up pilots that have been done and have been proven successful separately, have those conversations to see what does it take to make it fly. And I think that's important, otherwise corporates could keep pumping in money, government could keep subsidizing, but we don't get sustainable solutions. So many a time we've seen that why it doesn't fly is because the subsidized solutions, technologically it works, but there needs to be business model innovation to actually make that work. Everybody in the chain needs to make money. That brings me to the point of innovation. Now, if we need to have business model innovation, and I believe the youth in this country are really working with new technologies, innovating in every possible way in video, healthcare, lifestyle, everywhere. If we, from the government, could bring them a platform on which to innovate, invite them in, subsidize from a point of, say, giving them money to set the business rolling. And if it reaches a certain point, maybe be a venture capitalist and give in more money. But they need to find the solutions which work. And I think that kind of a startup environment focused on healthcare, and you could even specify these are the 5 areas where we need innovation, and that's where money would come in. I think that would solve a lot of the innate problems in this ecosystem.
thank you all so much. say this, I would actually thank my friend Vijay Girdhar and Esto's team who made this a lot possible because I am based out of Bombay. I could have contacted all of you on phone and email, but actual logistics were taken care of by his team, and when he came forward when he initiated this government industry a lot. So we did reach out to people for sponsorship. I personally envisioned funded this. So I thank him for coming all the way to help us get this done. And thank you all for taking up the time, more than half day. I'll say actually a full day. You come, some of you gave me yesterday night and in the flight late in the evening. But if I could get two things out is 2 action points from the other side of stakeholders coming as a partner, addressing the issue of mass cleanings and healthcare IT, which includes ML as such. And I'll be in touch with you over the next couple of days to send our proposals. And if you have not signed the pledge outside, please do that. We are committed to work as a team between the government and private sector. And we'll meet again and we'll decide what are the dates that we'll meet early next year. But before that, we hope some action will be set over it. Thank you so much.
Thank you.
Hi. This was